Hello, my name is Dr. Jesse Jutkowitz, and I'm the doctor who did the research, made the discoveries, and created what is now called advanced biostructural correction. I'm here to tell you that what your practitioner just told you about being able to correct everything on your body that's not cancer, infections, fractures, diabetes, or something like that is true. And I'm here to tell you how it's going to work. Now, you've all probably heard one of three things about people who do body work, be they chiropractors, osteopaths, physical therapists, massage therapists, or anybody else doing body work. You've probably heard, and these are reliable medical reports, not just your friends telling you. You've probably heard the guy's great, he saved my life. I don't know if it worked. And occasionally you've probably heard that guy almost killed me. Well, these three things, which have reliable medical reports to back them up, tell you two very important things about people who do body work. Number one, it tells you that if they can do it right, they can have fantastic results that cure things that medical doctors can't even come close to curing with surgery or anything else. Number two, it tells you that nobody really knows what they're doing. Nobody really knows the basic reason that body structures go wrong. Because if they did, they could correct your body structure every time and your body would be healthy. Well, I'm here to tell you that with advanced biostructural correction, the exact basic reason that body structures go wrong has been found, and your certified advanced biostructural correction practitioner is going to be able to correct your body structure and get you healthy consistently and predictably. Now, as you can see here, I'm going to explain exactly how it works and why. And the best thing I could do right now is get out of the picture so you can see this better.
All right, so now that I'm out of the picture, you can more clearly see we're looking at a body here, and we can see we've peeled the skin off, and we're just looking at the muscles, which is under that first layer of skin there. And what we're going to do is we're going to peel off the layers of muscles so that we can see the skeleton and the nerves there. And we're even going to peel away the nerves so we can just see the skeleton and maybe some of the spinal nerves you'll see in the back there. You can see the yellow, the spinal cord is in there. But what we're going to look at is the body view. On the left over here, we're looking at the spine and pelvis in a body with a few muscles represented. On the left, we're looking at this section, that same section of the spine shown in the box, with those same representations of the muscles. What we're going to look at is how the bones can move and whether or not the muscles can move them in certain directions, because that is what turns out to be the important thing. If you have bones, and this is just in your spine, but this goes for everywhere in your body, but in your spine, if you have a body that tilts, and the bone goes out of place slightly because it's tilted, you have muscles here on the side. You can see here on the right in this particular case, you have muscles on the side that can pull that bone and the other bones back into position. And of course, if you go to the right, you have the same thing on the left. You can pull them back into position. So that takes care of tilt. Now, if you have a bone that goes directly sideways, well, again, you have muscles that can pull that bone back into position, and that's true whether it goes right or left. Now, if the bone goes and the spine goes into a twist, well, you have actually those same muscles plus some other muscles back here that can pull those bones back into position, and that's true whether it twists to the right or to the left. Now, that's from the back view. If we look at the side view, again, we're looking at that same section of the spine from here. That's just been enlarged over here, and we're looking at it in this little section. When you look at that and you look at the motion of the bones, you could see if the entire body tilts forward, you have muscles in the back here that can pull that spine back. Now, you actually have larger muscles that go all the way down here. They're called the extensors. Those are those two big muscles. If you feel back in your spine right now, you can feel them just next to your spine. So you can use those muscles and you could pull that back and straighten out the body. And that actually is what happens when your body falls forward and you have to work hard to keep it up, which will show you can be handled and you don't have to do. Now, if one of those bones goes backward, And you can see it's not just one of those bones, the entire spine above it goes backward because they all work together and one sits on top of the other. But if that goes backward, you have muscles here that go from the front of the spine to the front of the body. Actually, that would be to the back of the ribs in your chest, and they could pull that forward. And then down here you have muscles that go from the front of the spine down to your pelvis, and this happens all the way up and down your spine. So if you have a vertebra that goes backward, you can easily self-correct them and pull them forward. Now, if one of those bones in your spine gets pushed forward, and people always ask, how does that happen? You can get hit from behind, somebody can hit you hard on the back, you could fall on your back. There's a million ways it can happen, all of these bones going out of place. But if you have a bone that goes forward, you would need a muscle here that attaches from the back of your spine to something behind it to pull that bone back into place. Unfortunately, human beings don't have that muscle. There's nothing there. Even if they had it, as you can see over here on the left, even if they had it, where would it go to? It goes back to nowhere because there's nothing behind your spine except for some skin. So what happens when that bone goes forward, your body tilts forward, it loses its leverage, and your body tilts forward, and you have no way to self-correct it. So it turns out that the most important thing that happens with bodies to cause structure to collapse and have problems, or to cause body structures to go wrong, is bones go out of place in a direction the body cannot self-correct because there are no muscles pulling in the direction needed to pull them back into place and correct them. Now, there are plenty of bones that go out of place in directions the body can self-correct, and the body sometimes leaves them alone to compensate for the forces created by the bones that go out of place in a direction the body cannot self-correct. But we're going to get to that later, and that ends up to be the explanation for how a lot of things go wrong. But what happens here, this bone goes forward, you have no muscles pulling in this direction to pull it back, and so you get stuck. Now, by the way, even if you did have muscles that attach from the spine to something behind it, again, where would they go? There's nothing behind there. They'd have to go through your skin, and you'd have to attach them to a hook on the wall or something like that in order for that to pull back. So that is the key. Bones can go out of place in a direction your body cannot self-correct because there are no muscles that can pull in the direction needed to retrieve that bone and pull it back into place. And that's more of a key than you could possibly imagine. What happens when that bone goes out of place is shown here. See how that body is stuck forward? Let's go back to the beginning here. Now what happens is somehow that bone gets pushed forward, and it doesn't just stay like that. It's lost its leverage. It's sticking out over here, and it's lost its leverage. So what happens is the entire body collapses. And that's why you get collapsed postures like you see here. If we show you actual people and you look at them, all of these pictures are breathe in, breathe out, relax, and let your body slump. They are relaxed in the before treatment pictures, and they are relaxed in the after treatment pictures. And you could see how their bodies collapse in the before pictures. All they had was one time, one treatment. You could see they're in the same clothing, one treatment with the advanced biostructural treatment protocol, and we asked them breathe in, breathe out, relax, let your body slump. Let your body slump. Let your body slump. And when they turned around and said to us, I am, or I can't, or something like that, we said, okay, let's do it one more time and we'll take the picture. So these people are trying to slump, and you could see they can't. So what happens is shown in this picture. Let's go over here, and what you have is the body starts up, the bone gets knocked out of place, and then the whole body goes forward. And the reverse happens. When we correct that, not only does the bone go back in place, but see how this person's still bent? Well, once that bone's back in place, your leverage returns and your body pops upright all by itself. So I can tell you the following. Number one is the key to what happens with bodies is bones go out of place in a direction the body can't self-correct because there's no muscles pulling in the direction needed to correct them. And if your doctor, physical therapist, chiropractor, osteopath, voodoo doctor, whatever, Rolfer, any of those people, if they are actually correcting your structure, when they say breathe in, breathe out, relax, and let your body slump, your body will stay upright all by itself. Now, I've shown a child here. I've shown some adults here. Let me show you a senior. This is the same type of thing that happens here with this woman. All right, breathe in, breathe out, relax, let your body slump. She came into the office, and these aren't even my patients. These are practitioners from around the world, because I don't want people to have the idea that only Jesse Jutkowitz can do this. Your practitioner is certified, and he or she can do this too. So we said breathe in, breathe out, relax, let your body slump, and this is where her body goes. Now, what you can't see, she's actually trying to hold herself up a little bit because she started to lean forward and fall also. Now, this picture is after day 1. The doctor did the ABC protocol and stood her in front of the camera and said, breathe in, breathe out, relax, let your body slump. Let your body slump. Let your body slump. And she said, I can't, it doesn't go anymore. And he said, okay, let's take a picture. Breathe in, breathe out, relax, let your body slump, and boom, this is the picture. In this particular person's case, you could see her body's leaning a little bit backward, but it's much more upright. It's not completely fixed up. Well, she had a lot of things stuck forward, worse than average. Here's that same woman after the second day. And by the way, this height thing here you see, that's not because the pictures are different size. She actually popped upward and straightened out and was taller. And that second picture is after she got treated on day 2. And it's breathe in, breathe out, relax, let your body slump. Let your body slump, let your, and we went through that whole routine. And that's what the picture is. So again, if you're getting treated and your body does not stay upright all by itself at the end of the treatment, whatever they're doing, it's not structural correction. And that's what you're going to be getting from your certified ABC practitioner. And the important thing here is that your body will stay upright all by itself because we are going to correct the bones out of place in a direction the body cannot self-correct because it has no muscles pulling in the direction needed. That's the basic thing that happens. And now your practitioner is going to take you back into the room and going to run the ABC protocol on you. And if I were you, I would insist on before and after pictures if they're not being done, because I would want to see everything that's happening. After you're home, I'll explain how everything I've told you causes your particular problem. In about 2 minutes, you're going to be taken back to see your practitioner. I'm just going to give you a brief overview so you can get yourself treated and get some relief. For just a really quick view at it, if you look here, what you have is bones out of place with multiple compensations. So let's go back to the beginning. Some bone gets knocked forward, your body can't self-correct, so it's got to compensate by pulling other parts up. You can see this red area here, that's because it starts to be painful. And not only that, but what happens is it starts to lever that other bone more forward and locks it into that forward position. So the top of your body is straight, but you're folded forward here, and you end up with sort of this angular fold forward. But you can't take that because it bothers your back much. So then you lean forward somewhere else, and you create another bone that goes out of place in a direction the body can't self-correct as part of a compensation pattern. Of course, you don't want that there because your neck is forward and your head is stuck downward. And this is why you see a lot of people, they walk and they look at the ground. Well, that's because they're stuck in this position. The people that can compensate end up using their muscles back here to pull this back up to hold their head up. Now, what happens is they've now run out of places to compensate because, all you have above here is your head and your hair. So this part right here is the genesis. It's the beginning of every neck pain and every headache and every tightness and all that. So where you have your pain is almost always at a compensation point. When you have headaches and neck pain, if they work on your neck, it's almost always a waste of time. This is going to be true for just about everything everywhere in your body, because the primary problem, where the bone's out of place in a direction your body can't self-correct because there are no muscles pulling in the direction needed, where they are, your body doesn't hurt because it has to shift the pressure away from that. Now it gets more complicated than this, and we're going to show you lots of what's going on, but this is enough for right now, and this will get you started so you can understand what your practitioner is doing. At this point, there's a quick 3-minute review of what we covered previously. If you're not interested in seeing it, hit the Chapter Advance button and we'll go on to the next part. Okay, we're back. Now, we left you going to see your practitioner if you were in an office. If you weren't in an office, of course, you haven't seen a practitioner yet. But we left you with this in this condition, and it shows a bone out of place with multiple compensations, and we had it written in and we showed you the steps. We'll go over that very quickly. Let's run it back. One bone goes forward in a direction your body can't self-correct, and the entire body above that goes with it and folds like you saw in those people who were slumped. The next thing that happens is your body gets far enough and it starts to compensate and it starts to pull back, and you get that straight flat spine between your shoulder blades. And this doesn't happen in the same place on every person. We'll go over that in a second. And it comes back and eventually gets far enough back so that it's forcing that vertebrae even farther forward, causing more pain and problems. And your body can't stand that. So what you do is you lean forward at that spot. Eventually you get far enough forward so that you can't take it, and you stop leaning forward at the body and your head and neck go forward. And at that point you have another bone that's out of place in a direction the body can't self-correct because there's no muscle pulling in the direction needed, right? There's no muscle that pulls in this direction. But that's part of the compensation pattern, so you can't even fix that one until you fix this one first. So not only do you have to find the ones that are out of place that the body can't self-correct to correct, but you have to get the correct sequence for that particular person's body. Now you don't want to be left like this, because now you're in a very forward position and your head is pointing downward. So what you do is you pull back here with these suboccipital muscles. The occiput is this bone here, so these are the sub or below the occiput muscles, and they pull back. And this is the beginning of every headache and neck pain you've had. Now, that's a simple forward, backward, and upper spine view. But there's quite a bit more to that, as I told you. Let's change the view and let's look at your entire body. Now over here on the left you've got how the bones fit in the body. This is a good one to look at. But let's take just the skeleton and let's add on the arms and the legs and the pelvis. So what we have here, we have the entire body, the pelvis and everything else. And what we're going to see is that bone goes forward. Same thing here. That bone goes forward. You could see it there. And you could see it affects the chest and the arms and even the legs. Now, not that much quite yet because it's only one thing forward. But as your body compensates, now you'll see it leans back, but look at this side view here. It leans back and starts to twist. See how one arm goes in front of the other there? It's starting to twist. And now if you look at the back view, you could see it twists off to the side. And as it twists off to the side, you can see it does some funky things to the shoulder blades and arms. And it twists them. But watch down here. Let me look at the bottom part, because some of you have upper back and neck pain or headaches or something like that, and others of you have low back pain and sciatica. So watch what happens as that thing twists. The pelvis starts to go twisty, and as the pelvis starts to go twisty, it affects the legs. Now some people say, well, how does it do that? Well, it does that through two mechanisms. One is through bone leverage alone, and the other is the muscles. Now, if we put in some muscles here, you could see, let's go to the top first. You could see this is a muscle called the lat. The technical name is latissimus dorsi. And when you do pull downs, when you reach up and pull down, you're using this muscle. Let me show you why. You can see here it attaches to the arm, but what you can't see from this view is it attaches to the front of the upper arm bone. So we're going to switch views here to this body, and we're going to turn it around, and you can see if we put all the muscles back, it looks like this. This is the skin stripped off, and these are the surface muscles. And if we peel down a couple layers of muscle, let's see if we can go one more. Nope, that takes that one away. So if we peel down a couple layers and we rotate this around, let's take a look. You could see the lat goes up through here, and if you go here, you could see that it attaches to the front of this arm bone here. It doesn't attach to the side, it attaches to the front. If we blow that up, you could see on both of these sides that it's the front of the arm bone, not the side of the arm bone. And that has very large connotations, because when it starts to pull in abnormal directions because of the way the lower back goes, let's take away those muscles, and you can see this lower back is in a curve here. Well, that changes the way the muscles pull, and it changes them unevenly. If we leave in just the left one and we go back, it pulls in that direction. But if we put in just the right one, you could see it pulls in a different direction. So that means that one arm is going to be bothered and the other arm isn't. Now there's another way to show that may give you the idea. If we put in just the right one, you could see as the spine curves in this direction, it's going to actually pull less. So one arm is going to bother you, or one shoulder is going to bother you. It can even cause carpal tunnel because of the way this thing twists, and it ends up with your wrist. See, if you look, let's raise this up a little bit so you can see. If you look here, and in this case it would be the left one, as the body curves to the side and it twists this arm around, it pulls, and it's going to change these two bones of the arm also. Because it could change any of them, and because there's more than one muscle pulling and more than one bone out of place and much more than one pattern, it can happen anywhere down the arm. Now let's go back here, and again, if we put in the right one, that one as the spine curves in that direction, the bottom might pull more, so it'll change a different part. On the right arm, you could see the right arm is actually more turned because one part is loose and the other part is pulled. Whereas on the left one, what's happening is it's pulling the whole arm in, so the arm is closer to the body. You can see that here. The arm is closer to the body, but it's not as twisted. Now let's look at what effects that can have on the lower body, since some of you are watching this because of back and leg pain. If we take that same thing and we look at, these are what's called the hamstring muscles. We're looking at them from behind. As the pelvis twists, you could see the way these muscles pull, and you could see the knees and legs. Not only do they go up and down, all right, this is how some people say you have a short leg. Almost nobody has a short leg unless it's been broken or anything like that, and most of those aren't short either. By the time we get done treating people, they need no heel lift. We have to take it out of their shoe. It causes huge problems because as long as your body's crooked like this, it needs that lift to compensate. But with advanced biostructural correction, we're actually correcting it and bringing it back to normal, back to here. So now the lift causes a problem because you don't need the compensation. But we'll talk about that in a little bit. So this pulls and turns, and you can see if we go far enough down, you could see that that same pull and turn affects the alignment of your ankles and your feet and twists them in place in different directions. So this affects your entire body up and down all the way through. Now I'm going to switch the spines, and we're going to look at this view because there's a level of twist meter here. And what happens is that first thing, boom, that goes forward. It compresses your chest and causes problems. And this is not bad. Then the body leans backward, just like we showed you before, and starts to curve off to the side. And as it curves off to the side, remember you have these muscles pulling on the pelvis. See, the pelvis is going twisted here, and the arms and legs, everything's going twisted. Now what happens on your particular body depends on how you twist, and we'll show you that. One thing you could see here is, see this curve in the neck? That curve is supposed to be there. It's supposed to look curved like this. So let's take a look at all these curves. From the back view, it should be straight up and down like this. From the side view, you have what they call cervical. Cervical is Latin for neck. You have the cervical curve, which looks like this. And then you have the thoracic. Thorax is chest. So you have the thoracic curve, which goes this way. And then below where your ribs are, because that's what makes up your chest, is really your ribs. You can see your spine is really one thing. And to say you have a neck, a back, and a low back is, it's basically idiotic. It's a thing left over from anatomy, where they do what's called regional anatomy, where they'll look at just your neck and just your arm and just your chest and just your low back. So they do that in regional anatomy. So it's convenient to carry that over into the clinic, but it's stupid because your entire spine, as you see, when this thing goes, your entire spine changes like one thing, one part compensating for the other. So that's why people make a mistake and think you have neck pain. And it's really neck pain, that's true, but it's caused by something else. So anyway, here's the thoracic curve. And then here is the lumbar curve. Those are your normal directions of the curve. And then down here you have your pelvis. So let's put the ribs and arms back. So boom, this thing goes forward. You lean back, and you're still, this is not too bad, all right? But look what happens. Your neck is going flat here. You're losing your curve. It's stretching on your spinal cord and brainstem. Depending upon where the curve is down here, it pulls on different parts of your spinal cord or brainstem. And as this twists backwards, see, it doesn't just go backward. You look at this view, it looks like backward. If you look at this view, you can see it twists backward. It doesn't just lean backward. It twists backward. You go far enough back so you're off balance backward, and now you have to drag something forward. And look, that neck is getting stretched, and look at how far forward that neck is. Now, let me show you this picture here. When your head starts going forward, you have what they call forward head syndrome. All right, it's just, you know, they name these things idiotically because they say your head is forward, and it is. But then they only look at your neck and try and redo the curve in your neck, and trying to do that without addressing what's going on lower down, again, is it's the work of an ignorant person. Ignorant means somebody who doesn't know. It's not like saying they're stupid or anything. They're not stupid, but they just don't know, and they don't think to look at it. All right, anyway, so that goes forward. Let's go back to this view. That goes forward, and it goes forward far enough so you can't deal with it well because it bothers you, and then your body starts being dragged forward, and now your entire body is forward. See, it's forward and to the side. You can see here on the side view it goes forward, but look at the back view. It goes forward and then it twists to the side. Now look at how straight this back view of the spine is. That looks like the spine is straight. But if we blow that up a little bit, you could see each one of those bones is a little bit crooked. So what you have, it's like when you twist a rubber band and then you stretch it at the ends. All right, so when it's over here, you're not too far forward and your spine isn't stretched end to end too much. As you go forward here, it stretches your spine end to end, and it looks straighter from this view, but it's really not. It's actually more twisted. So here's just a rubber band, and here's what happens. That rubber band, as we twist it and leave it slack, it twists around, and eventually, as we leave it slack, it bends to the side. If we stretch the ends, see how that gets twisted to the side? Now what we're going to do in this direction, we're going to stretch the ends. And as we stretch the ends, look, it gets more twisted. See how this is wide here? Each one of these turns is wide. As we stretch the ends, it looks straighter, but it's actually more twisted. And when it's more twisted like that, it's actually more tense and more locked up, and this is how you lose your motion. So let's go back to where we were here. And when you start, look at the right, the meter here, as this is starting to get up into the red area where you're having serious problems. Down here, you're losing your motion and you're a little bit stiff. See how the spine's straighter there? It's already starting to pull. And then it goes even farther off. Something happens, it goes farther off. And then you start going forward, and to go forward like that, you have to shift on center. It pulls it and stretches it just like that rubber band. So this is very twisted in here. And now you've lost a lot of motion, and you're going forward. And now you're so far forward, you're off balance, so you have to lean backward, and boom, you have a collapse. Now, we already showed you what happens with the muscles here. But let's show you what happens with the organs. Now we have a picture. We've got the spine and the skeleton over here, so you have a reference to look at, and we have the organs in. And we could show you a front view, we could show you a back view, and we could show you a side view. Let's start with the side view. You see this bone goes forward just like we showed you, your body leans back, and it's the same sequence. So look what happens to the organs here on the right. As this first one goes forward, you can see it compresses your chest and your upper abdomen, and then you lean back and you turn. Look what's happening to your intestines here. This is affecting your colon and your intestines. It pushes a little bit on your kidneys, so all of a sudden you have to go to the bathroom more frequently, and they're checking your prostate and all these things, and that gets affected too. If we look at the front view, the prostate is way down here, and you could see as the pelvis tilts, see how you have that view? See how this comes up? So the pelvis tilts and that gets compressed too.
Not all prostate problems are structurally based, but quite a few are. I spoke of prostate problems because this skeleton is a male model, but female problems likewise often disappear. While correcting structure is not a cure for all the possible reasons of infertility or other female problems like menstrual cramping and more, they would also be surprised at how many cases of menstrual cramping and other female disorders have disappeared after structural treatment. Every chiropractor, osteopath, and anybody else doing manipulation has many patients who can confirm these points.
So this changes and it turns, and look what it's doing to your intestines, and look what it's doing to your chest here. You have trouble breathing. All right, if you've already been treated with advanced biostructural correction, you noticed immediately it was easier to pick up your chest and move your chest. Well, that's because this got corrected. Now, as this gets twisted more and more, you come forward, and then boom, you have that collapse. Now look at how this compresses your intestines and those organs. That causes major problems. Let's look at the front view here. See, if we look at the front view, now it's already showed twisted. But let's start from the beginning, and it does some pretty funky things to your intestines. You see these people walking crooked. Their intestines are affected, their liver's affected up here, their stomach's affected, and this gives you acid reflux. Now, what's the mechanism of acid reflux? Well, let's look at this from the side again. Once this starts to compress your stomach, when you eat food, it goes into your stomach, which is right here. Now that thing gets compressed, so when your stomach starts churning the food and adding acid, it's supposed to churn it, and after it churns it, it's supposed to, if it's fairly normal, not even all the way normal, let's take a moderate level of twist. If it's a moderate level of twist, even though you're crooked, look over here, see you're still crooked? Even though you're crooked, you have room for the stomach to then empty out into the intestines when it's time. But once this thing compresses forward, and let's get to the side view here, you can always tell we're at the same place by the level of the twist on the right there. Once this starts compressing forward, all right, and it can compress forward here, see this is compressed, even in the yellow region. Once that starts compressing forward, what happens is your stomach starts to churn and there's no room for the food to go downward. See right here, it's compressed, so there's no room for the food to go downward. So what happens is it goes up, and when it goes up past the top of the stomach and up into what they call the esophagus. And that's the food tube that goes down from up here from your neck, it goes down. So when the stomach churns and it pushes that up, now that would be no big deal except for the fact that you've added acid to the food to break down the proteins, and the acid now starts eating away at your esophagus because it does not have a mucus lining like your stomach does. And that's your mechanism for acid reflux. And it gets worse as this gets compressed. Now, that's one pattern. Let me show you a little bit different pattern. All right, so this is another person, another case. We're going to look at it from the side view that we had, and you can see the level of the twist is 0 here, so this is an ideal case. We don't see anybody walking around like this. But this person, boom, that thing goes forward, but it doesn't go forward the same. In this case, the person leans backward, and look at the chest getting compressed. And that chest gets compressed more and more and more. And you can see the abdomen, the top of the abdomen is getting compressed here. See, this level right here is still the top of the abdomen. The chest is way up here and the lungs are way up here. This is your liver and gallbladder. So that's at that level, and that's getting compressed. And when that gets compressed like that, that gives you big time acid reflux, or even worse, it compresses your heart and lungs and you can't breathe. So what you have here, if we take a look at it, here's your heart inside your chest, and as that thing gets compressed, you can see your heart gets, pardon this big medical term, your heart gets mushed in. And this is major problems. They actually have a lot of research now that heart disease, atherosclerosis, is caused by the chest shape change that compresses the heart and it slows the blood down, so the various components of the blood start precipitating out into the side walls of the blood vessels and hardening the arteries. So let's take a look here. Here you have, it says here, normal healthy chest. Well, that's not normal, that's fantastic healthy chest. All right, where it says here moderately compressed chest, that should say normal, because that's a person who's fairly normal. Their compression is in the green, maybe lower yellow range, when we look at the amount of twist they have. That's what you see. So you get ABC and your body improves to over here and you get fantastically better. And then somebody who's got some serious problems, you can look in here. The heart is not quite pumping as much. It's maybe pumping 70%. So that's 30 to 40% loss right there, and that's not too bad. There's people, their chests are cave in and they lose a lot more than that. All right, let's get back to this picture over here. Let's take away the arms and legs and let's start looking at some of the things that happen to the spine here. Now when you change the view here, we're going to put in some of the small muscles and we're going to look at an extended version of that bones out of place with multiple compensations. Here's the entire spine with bones out of place with multiple compensations. Now remember, the arms and legs are still affected, but we're not going to show you that. We're just going to show you these. So boom, here you have, this is that same case. You have this goes forward and the body goes into a fold forward. Now it starts to twist to the side, and as it twists to the side, these muscles are pulling constantly. So when you say it feels like a muscle ache, it is a muscle ache. But the reason it's a muscle ache is the muscles are constantly being pulled and twisted because the bones are out of place. As soon as you put the bones back in place, the muscles stop being twisted and they rest almost immediately. It is a fantastic side effect of a treatment with advanced biostructural correction that people almost never get sore. They don't get that muscular soreness. They get tired, but they don't get that muscular soreness. Back to the sequence of what happens. So that bone goes forward and then your body twists to compensate. That's the first thing that happens here. Your body can do several things there. If we look at a view, a close-up view, that bone goes forward, and then one thing your body can do is it can twist the bone. See, look at this side view. It twists the bone to try and get this part back. Now it never comes back because you don't have any muscles pulling in that direction, but it at least twists it to try and stabilizes it. The muscles get tighter right in here. Like I said, you may get sore, but it's pulling on that to stabilize it. And then after it does that, it starts to tilt and it starts to add other situations here. That's one set of things that happens. Another thing that can happen, let's say that bone goes forward and now your body doesn't twist. This time your body tilts. See, look on the side view here. First thing your body does is tilt. And then when it tilts, now it goes off balance in a different way, and now it's got to twist somewhere else. So you could see, look at this pattern here against this pattern here. So this one goes to the left and it twists first, and then your body tilts. And this one tilts first and then twists above that. So you can have that happen. There's another thing that can happen, and what that is extension. So your bone, that bone goes forward and then your body pulls into extension. Now I'm exaggerating it here and I'm not showing the disc move, just to show you the extension. That's the exaggeration here. So let's go back to the beginning and let's do it without the exaggeration. So the bone goes forward and it pulls into extension. Now it doesn't just pull that one bone. See how all these bones move? In that first example, this came forward and then that one bone moved. Well, that doesn't really happen. It's more involved than that. What happens is more like this. That bone goes forward, your body pulls into extension, everything extends. See how this goes flat over here? Look at the side view. This goes flat and goes into extension, and then you're too far back, and then your body twists. If you look at this back view here, this looks much different as this thing comes backward and then goes sideways, whereas the other ones went to the side or twisted first. So you can have very different patterns occurring. And if we go back here, you can see here's one pattern. So that bone goes forward, the body twists to the side, and then it starts to lean the other way to compensate, and then it starts to lean backward in a twist. And now look what happens. See, look at the leverage you're putting on here. We've already showed you how when this comes backward, it levers on the yellow bone. But then the entire spine comes backward and it levers here. Now it could lever lower down here, it could lever even lower down there. So where it levers depends on where it's going to pull on your spine, where it's going to pinch your nerves, and where it's going to cause problems. Let me break in here and just note that if you understand the whole bones out of place with multiple compensations thing and can imagine how the leverage changes and causes your particular problem, you can hit the chapter forward button and skip a long explanation of how different leverages cause different problems in different people's bodies, including your particular problem. So where it levers depends on where it's going to pull on your spine, where it's going to pinch your nerves, and where it's going to cause problems. But now it's back, and now you're off balance backwards. So again, you lean forward, and after you lean forward a certain amount, you start to have to twist in 3 dimensions, but then it drags your body more forward, and then you lean backward lower down. Now you can't see it here because the pelvis is in the way, but look at this view over here. See this bone? We turn it red because that's L5. That's that lowest bone, lumbar 5. That's the lowest movable bone in your spine, and now that's getting levered forward and compressing there, and it's compressing the bone and it's compressing the nerve, and you're having problems down your leg. Now, to take some of the pressure off that, you have to lean your head forward. Now, remember what happens here? Now you have your head down, and you see people walking with their head down the street. And the suboccipital muscles. Remember, this bone's the occiput in your head, and these are the sub means below in Latin. So these are the suboccipital muscles, and they pull backward, and now you have headache pain. So here's a sequence where this bone goes forward and then starts to twist, and that doesn't give you too much. You might have a little bit of pain in your back from that after doing something. But then this thing starts to move backward here, and this pain becomes much, much smaller, while the pressure of this causes pain back here. And you have people right in the middle of that curve saying they have pain. And then the body shifts differently and starts to twist, and your head comes forward, and it starts to pull. Now, instead of it being over here, it's higher up, and it pulls this bone forward. And when it's higher up like that, then it starts to hurt more, as this one hurts less because you lean forward and you take pressure from one area and put it on another. And so you twist there. You could see, look, this starts to twist and it starts to hurt. And now the whole body goes backward. And when the body goes backward like that, this pain reduces. Sometimes it disappears, but at least reduces. And now this pain gets very small or non-existent. And what happens is this pain shifts down. And now it's over here. If I can show you on this picture, see where this bone is red here? So your pain is getting big in the lower back. And that's what happens. It's way down in the lower back now that you have that pain. And so because of that, you don't want to have it, so you lean forward at the head. Now, when you lean forward at the head, it takes pressure off the bottom here, and this becomes less. Unless it pulls on your brainstem, which causes pulling of the nerves, and then you get nerve pain. There's different, you can have back pain and you can have back and leg pain. If this pulls, if this stretches all the way down like this, and it pulls on your spinal cord too much, you can have leg pain. You can also have head pain as it pulls on it up here, and other different effects. Your vision can go blurry. You can have lots of things. But now you have this head down posture and you're all bent over. And so you don't want to do that. So you pull with these suboccipital muscles again, and now you have your upper back and neck pain, and you could work on that forever and it never goes away. This is something I want to emphasize. So again, the pains you have are at the locations of the compensation patterns you create with your body, because it is the pressure of the compensations that causes the pains. The damage you have is also at compensation patterns, because it is the pressure of the compensations that causes the damage to the bones and discs. However, it is where you have the bones out of place in directions that your body cannot self-correct that are the real problem, and the only place where you need correction so the compensations will disappear. A typical sequence is in a car accident. Now, there's always the, how did Jesse discover all this? How did Dr. Jutkowitz figure this stuff out? Well, let's take a look at how I did, and it has to do with taking X-rays, which are not that hard to look at. You guys have been looking at spines here for a little bit. This is what the spines look like on X-rays. Let's center this thing a little bit. And what you have here, here's a standing view, and here's a standing view. And they look like this. You could see here the curve in the neck is gone. This is flat. Remember, it's supposed to be curved like this. Well, it's flat. And the curve in the back is gone. Look at how flat this person's back is in the middle, in the thorax. There's no curve there. It's supposed to be curved like this. Well, you don't have that. And then down here, you have actually too much curve. It comes too far back. And this person's set way back. If we put a center line, his weight should be on center from the side. It should look like this. And it's way set back. Now look at the front view, and you could see here, if we blow this up a little bit, you can see each one of these bones goes in a different direction. This one goes this way, this one goes that way. So even though it looks like this person is leaning backward, the spine is too straight for how many twists they have, and so it's got to be stretched in this direction. Remember this rubber band where if it's slack it bends out to the side, and if it's stretched it's more twisted? Well, that's what's going on with this spine. Now you look at that, and that looks pretty lousy. But you don't notice how lousy it is until you take those same set of X-rays with the person sitting. And this is that person immediately after sitting. The way we take these X-rays is we stand them up, we have them face, this one's first over here. Face the X-ray camera, breathe in, breathe out, relax, let your body slump, and boom, we take a picture of the body. Then we change the cassette. The cassette is the thing that holds the film. And we change the cassette, and we turn them sideways and have them put their hands on their elbows, and we say breathe in, breathe out, relax, let your body slump, and they take this picture. That's it. Then we change the cassette again, and we have them sit on a flat stool. And when they sit on the flat stool, they put their arms to their side and they take this picture. Breathe in, breathe out, relax, let your body slump. And you can see this picture is different from that picture over there. But all it is the same view less than 2 minutes later. It doesn't take very long to take these pictures. And after we take that one, you change the cassette and you spin the chair sideways. And you say breathe in, breathe out, relax, let your body slump, and you see this collapse here. Now, the reason you see that collapse is because of what happens in a car accident. It can also happen from anything that gives you a sharp impact to your back, like a fall. And keep in mind that what is a small impact to your back now might have been a very sharp impact indeed to your back as a young child who fell on their back. Now, this can also happen from prolonged sitting bent forward. In that case, it takes much longer to develop the situation, but the bones get dragged forward as you fatigue or get tired, and in the end, it has the same effect. But let's talk about a car accident or some other sharp impact from behind, because this particular guy was in a car accident. So what happens is the car comes along and hits him. The seat hits here. See, people think that if we let's go back to a pretty good looking spine here. This is a fairly good looking spine. It's a little bit forward, but a fairly good looking spine here. And people think when you get into a car accident, because the seat is here, that the head whips back and forth. Well, that may or may not be true. But if you ever noticed, they have those headrests so your head doesn't go back and get whiplash, but people still have it. They still get severe neck pain because of car accidents. And the reason is nobody seems to understand. Look at the way this chest is curved. See that? That is pretty good. Close to ideal, not quite ideal, close to ideal. And then look at this X-ray with the person standing. It's collapsed in. Look at them sitting and you can see how collapsed it is. So what happens here is the car seat is over here while the person's sitting down, and the car seat, this thing gets slammed and the car seat gets pushed forward, the head stays there, and this curve here gets flattened out or reversed. Now, depending upon how much damage it does to the person, look what happens here. The car comes here and bam, this gets pushed forward. Okay, now that you've seen what happens in a car accident, we have to go over what happens with some various types of treatments, because a lot of times they lay you down on your belly and they push down on your back. So here we have a body, of course. Now let's take away the ribs here and you look at the spine and you can see you have this one vertebrae forward, and the theory is that if you shove this one forward, the other one will come back. But if you actually look at X-rays before and after, and they don't quite look like this makes it a little bit more obvious, but it looks like more of a tilt. But when they come along here in your back and they push down on this bone, and sometimes you go, ooh, now it'll shift your mechanics, but watch what happens. Now it pushes, and now you have two bones forward. All right? And a lot of times it's a little bit difficult to get up. If you have several, let's take a look here. Same type of thing. And now you have several anteriors, so they push, and if they push hard enough, now you can get a whole sequence of things going forward. All right? And you know how sometimes you lean backward and you push your back in? Well, you have this bone going forward, and then you stretch your arms back and you stretch your body back, and what you end up doing is you end up levering something more forward, and you go like this, and now when you get done, you feel better because the mechanical stress is off this area or less at this area. But when you get done, now you have several things forward. And an interesting experiment is to take a deep breath and lean backward like that if it's something you do that feels good. And then you take a deep breath afterward and you notice the places where you were bothered don't bother you anywhere near as much. However, you can't quite breathe as well. Well, that's because mechanically you've actually made your body a little bit worse overall. All right? And then here's what happens. If you have one treatment where they push you from behind forward, so you're here and you end up like this, and then you end up stuck forward. And it's not a good thing. This is a lot of times when you look at posture pictures, you notice the person's leaned forward, but they look straighter. Well, that's because if this person goes into a rest, they just collapse forward like this. And this is not because I don't like people or I'm trying to make people wrong, but there's a technique out there called Chiropractic Biophysics, and they push down on your back here, and they traction your head back, and you end up stuck forward like this, and they show you your neck curve looks better, and often it does. But that's because it's the only way you can prevent yourself from falling forward onto your face is by holding your neck up and making a curve back like this. Now, if they stand you against the wall and they do it, and this is the type of treatment that you may get with advanced BioStructural Correction, but if they push too hard, what happens is they get a bit of a correction there, and then they create anterior. So don't let anybody push you hard, and then you notice when you come off the wall you sort of fall forward like this. All right? And that's because it's actually pushed something forward. When you get treated properly, your body should stay upright without having to go forward. All right, let's continue, and I'll show you why nobody notices this. What happens here? The car comes here, and bam, this gets pushed forward. Now, most people never get to notice this. And the reason they never get to notice this is they take standing X-rays of just the neck. And here's what that looks like. Now, I'll bet that even those of you who have never seen X-rays before and looked at the standing and sitting full spine films that I was showing you are overwhelmed by the lack of information that you have when you just take an X-ray of the neck. And this is what people are basing their treatment on. It's no wonder they don't understand what they're doing. This lack of information is especially apparent when we keep in mind what happened to the entire spine to get the neck into this shape to begin with, and that the reason the neck hurts has almost nothing to do with the neck itself except as part of the compensation pattern as I showed you in this sequence. Even more importantly, when you measure the angles of all the vertebrae in all the directions, you begin to see many things you did not see otherwise. One of those things is that there is no motion in this person's thoracic section of the spine. That means in the area where their chest is, there's no motion of the spine. If you measure the relative angles of the vertebrae to one another, they don't change at all from sitting to standing. And I'll show you that here on the films, and then this is what it looks like in the animation. As you watch the body move from sitting to standing, this entire section does not change. That means the neck above and the lower back below have to move more than they are designed to move to make as much motion as possible available to this guy when he changes position. So that causes stretching, pain, and degeneration in those areas. And look at the compression of the organs. It changes from sitting to standing greatly, but it is always somewhere. No wonder this guy has no energy and doesn't want to do anything. He can't breathe well, and as you can see in this cutaway view, even his heart function is compromised, especially standing. I've been teaching these things to practitioners and patients for a couple of decades, while trying to teach them, but most have never really understood the effects because the heart and other organs are not seen on X-rays. This type of analysis, looking at the entire body, even the organs, gives you a complete correlation between the person's structure, or the breakdown in their structure, and the person's symptoms. Even emotional symptoms are often related to the structural breakdown. In both this person and this other person, with different but similar breakdown patterns, the length of the spine is greatly increased in the sitting position. This leads to pulling on the brainstem and emotional feelings of depression and anxiety that no medication will ever solve. Further, if you stand them up and have them stay upright for a few minutes, you question them and discover that they tell you most of the feelings of depression and anxiety have disappeared. Looking at the measurement of the spinal length from the coccyx, or actually from the sacrum down here all the way up to the head, you discover that in the standing position it is 71.5 centimeters. Now, the healthy normal for this guy's height is 68 centimeters, so that's a mild but significant stretch of 3.5 centimeters, about 1.5 inches. Now, that stretch on the brainstem and spinal cord, you'd be mistaken to assume that the stretch was evenly distributed along the entire spinal cord and brain, but that's quite a bit beyond this discussion. So in the sitting position, you notice the measurement here is 81 centimeters. That's 13 centimeters, or 4+ inches of stretch on the cord and brainstem. That not only affects the nervous tissues in the brain and brainstem, but it reduces the blood flow and the cerebrospinal fluid, the fluid in your brain and spinal cord, and it makes it difficult for this person to think. And it creates emotional feelings of depression and anxiety, not to mention ADD and all the other supposed offshoots of attention deficit disorder that describe why people have difficulty paying attention to anything, especially kids. Well, let me stretch your brainstem a few inches and see how long you can concentrate on anything, or how long you can sit still. Medication will never handle this, ever. It's a structural thing. We've taken a class of young children and treated them with ABC. What we discovered was that most of them were less active during class, showing more attentiveness and better understanding of what was taught. Yet those same kids were much more active during recess. When I asked them about it, almost all of them said that they didn't hurt anymore, so they didn't have to fidget, and they were more active during recess because their bodies didn't hurt or bother them anymore when they ran or jumped or slid down a slide or did any of those things. I never thought to ask them, but when the parents later asked them why didn't they say anything, every one of the kids said they never knew that what they were going through was not normal. This is throughout the world and across all ages. You'd be astonished how many adults tell me the same thing after their first treatment or two. They come in to get one thing fixed and they say, "Hey doc, is this thing fixing my stomach, back, neck, all this stuff?" This happens because with advanced biostructural correction, everything in the body improves, because it is true structural correction rather than just moving things around or banging things around and hoping for the best. Most people think that headaches, stomach pains, and all these other aches and pains in the body are normal. They are not. It is just that nothing else ever got to the basic factor that leads to correction of all sorts of body problems, so there was never anything anybody could depend upon. These breakdowns in structure do not occur with everyone this way, but they are much more common than anyone thinks. This is the stuff that ages bodies. Even people who don't hurt tend to go forward and fall forward. Well, their bodies just compensate really well, so it never gets to the point where they hurt, but they still go forward. I was showing this video to a patient the other day to test it out for understandability. He said it was very understandable, but he didn't know how it related to him. I took out a ruler, put it on his spine between his shoulder blades, and asked if he felt the ruler all the way along its length. He said yes. I said, "So you have a similar flat spot?" He was astonished, and he asked to redo it standing. That flat area was a bit shorter, but very much there. When we checked his breathing without me supporting his lower ribs or anything, it was a little bit stuck, but he didn't really feel it. And then I supported his lower ribs by just putting my hands on them and gently holding them up about 1/4 of an inch. When he took a breath, it was so much deeper he was flabbergasted. Not only that it was deeper, but how much easier it was. But he was happy to know that he will shortly be breathing that well without help as his body is corrected. Now, anyone can do that type of test where somebody holds up their ribs and then they breathe to find out how much better their body can get. But a flat spot is not the only pattern people have that are degenerating. It just means you have to look at other things in their body. And we're going to take a break here in a minute, but if you want, you can stick around and look at those. Now, between noticing the spinal changes I have shown you and how they affect the ribs, which compresses the chest and heart, slowing down breathing and blood flow, and how those changes affect the pull of the muscles on other bones in the body, which lead to twisting in the arms and legs and misalignment of those joints, as well as noticing what happens to the brain and brainstem as this gets stretched in this analysis, and the picture of what happens to the organs as the body structure degenerates and they get compressed and pushed in different directions, you begin to discover that my statement that correction of body structure with advanced biostructural correction will consistently and predictably lead to the correction of every body problem that is not directly caused by cancer, infections, diabetes, and things like that, is not just some wish or philosophical statement, but is what actually physically has been happening with patients and practitioners of advanced biostructural correction for a few decades now. For those of you who have seen enough and do not want to go through an analysis of several other body types and what happens to them, but want to know about the solution to all this and how it can work consistently and predictably on just about every human body, hit the menu button and go to the chapter on treatments and solutions. For those who want to see more analysis and other standing and sitting full spine X-rays and analysis of their bodies, keep watching. Okay, so now that you know about body structure going cockeyed and creating all sorts of problems, and many more of people's ills relate to cockeyed structure than anyone commonly seems to think. Now that you know that, we can move on to talking about fixing bodies. But just before that, I want to make the note that some people go crazy off the deep end with this and think that everything is body structure problems. That is not so. You know, if you have infections and don't kill the infecting germs with tea tree oil or iodine or methylate or something like that, or if it's an internal infection and you don't get antibiotics, well, just be prepared to have some very nasty things happen or even die. And that's no exaggeration. Remember Jim Henson, the guy who created the Muppets? He died because he got a rash, didn't wash it or use basic sanitation, and then he let the infection get so bad before seeking treatment they couldn't pump the antibiotics into him fast enough, even using them intravenously, and so he died. On the other hand, thinking osteoarthritis is some sort of infection or virus when it is just bones rubbing together and, you know, growing cockeyed because of the different pull of the muscles and ligaments and all that stuff, well, that's a bit wacky, if not worse. Same thing with thinking a stiff neck is sort of a virus. That's just crazy stuff. So don't think I'm one of those nuts who think everything is structure or structure gone crooked. But structure gone crooked or cockeyed is more of a cause for more body problems than anyone thinks. So on to fixing bodies. Once you know about bones going out of place in a direction the body cannot self-correct versus the bones that go out of place in a direction the body can self-correct, God, it always stuns me to think that no one else noticed that bones going out of place that the body can't self-correct is a key thing that happens to bodies. Anyway, once you notice that, consistently fixing bodies becomes fairly easy. It's not necessarily fast, but it is fairly easy. What I'm going to do is a quick statement on what needs to be changed as far as people's understanding and thinking, and then we'll get to the details of getting bodies corrected. Virtually all methods of structural treatment of the body intend to align the structure by forcing the bones into what is considered their correct position according to some idealized state determined by anatomists. That they're trying to force bones into place is true whether the method intends to accomplish it by movement of the bones themselves or as a follow-on effect to changing the pull of a muscle or working on the ligaments or some other tissue. Among these are the so-called mirror image treatments. Well, none of these methods has ever worked consistently on anyone. That is true for two reasons. The first you already know. The whole bones out of place in a direction the body cannot self-correct thing with its compensations and all that. The other factor is the meninges. Meninges is a Latin word for coverings. What I'm talking about when I say the meninges are the coverings of the spinal cord and brain. Whether bones are out of place in the directions the body cannot self-correct or just part of the compensation pattern that the body can self-correct but does not, the spine must twist as these bones go out of place. When it twists, the layers of the meninges are twisted so they touch in unusual ways. They often grow together in these unusual ways, creating adhesions or scars that prevent motion and keep the spine locked in a twisted direction. These meningeal adhesions or scars then become major factors preventing movement of bones and sometimes directly creating major problems with the spinal cord, brain, and other parts of the nervous system too. Meningeal adhesions are sometimes known as perineural adhesions. Peri means around, also in Latin, and neural means relating to the nerves. So these are adhesions and scar tissue around the spinal cord, other nerves, the brain, and the brain stem. Perineural adhesions is probably a better name because the scars or adhesions sometimes involve more tissues than just the meninges. But I've been calling them meningeal adhesions so long, I'm going to stick with that for this video. Meningeal adhesions are known by many practitioners of manipulation and other bodywork methods attempting structural correction. However, the actions of the meninges in relation to keeping bodies stuck in a compensation pattern is not understood by even 10% of healthcare practitioners, probably not even 5%. Not properly addressing meningeal adhesions is the reason manipulation most often fails to permanently improve posture or to change mechanical stress patterns for the better, as advanced biostructural correction does. So meningeal adhesions are a big deal, a very big deal. You have seen this cross-section of a dissected body showing the adhesions around the spinal cord, sometimes fusing it to the bones and sometimes not. Well, there are plenty other examples, and every medical and chiropractic student who dissects a cadaver sees them, but has almost no idea of their great significance. Among what doctors often miss, but people like you can readily see, is that because the meninges are elastic at all places besides where they have grown together to create the adhesions or scars, the spine is actually twisted up like a large elastic band. This is true especially in people's bodies, including kids' bodies, even young kids' bodies, that are obviously bent at some point, stuck somewhere, have bad posture, walk funny, run funny, or can't run, or just cannot move freely somewhere, and even more. And this is true in those people's bodies whether they are to the point it causes them pain or not. I just returned from a seminar and workshop in New York where a very happy practitioner was telling me that immediately after I demonstrated the treatment of infants on her 11-month-old grandson at the last seminar about 4 months ago, he grabbed the stroller and was walking around pushing it just about constantly for a couple of days. Then he just started walking on his own without the stroller, and his dad has been having difficulty keeping up with him ever since. This is a child who would not even get out of the stroller, and even had been having difficulty crawling before that. Now that's an infant. I can relate many similar observations of people, adult and senior too, who had no pain before getting treated with ABC, but suddenly could function beyond what anybody thought possible for them after getting ABC treatment. And these are not just my stories. These are stories from ABC patients worldwide, and they come into the office here daily. These sets of X-rays are typical examples. You can see these areas are twisted and bent because of the tilts of the spinal bones, but they change when the person changes position from standing to sitting. So they are quite twisted, bent, and under such great stretch or tension that they may be causing big problems, but they're not stuck. These areas are twisted, bent, under great tension too, but they do not change from sitting to standing, so they are the stuck areas. Now, they may be pain areas and they may not be pain areas, but this is the reason you must do multiple position imaging if you're to really know anything about what's going on with a particular person's body. Now, you don't need to do that to fix them, but if you want to understand what's going on, that's what you need to do. Because of the adhesions or stuck points, you can't assume that the stretch or tension on the spinal cord, brainstem, or brain is spread out evenly. In some people, it will be here, affecting their breathing and heart. In others, it will be here or here, just causing pain. Others will have it higher, as I showed earlier, and it might affect their ability to think or concentrate, so much for a chemical or brain cause of ADD. But most people have a combination of areas stuck. In any case, areas that do not move well, or do not move at all, and cannot be easily corrected to move as they should, are being adversely affected by the meningeal adhesions, and nothing but a properly done meningeal release will get that loose. But again, the problems can be where the meningeal adhesions are, or the problems can be in other places that are stretched to compensate for the adhesions. So it's not always in that spot. As I noted earlier, you can compare the various areas to a twisted, bent, and stretched elastic band, or even a tightly twisted, bent, and kinked spring. When I first did this experiment with the rubber bands, it was astonishing to me how exactly a twisting rubber band does exactly what a spinal column does. Now you see this only if you take standing and sitting full spine X-rays in the front view and side view positions, and then analyze the forces by measuring the changes in the tilts, bends, and twists of every vertebra in 3 dimensions, and then compare the effects of the differing mechanical stresses when the body is weight-bearing and upright, but unable to use the feet and legs to compensate as it is when it is in the neutral sitting position, and then compare that to the change in those tilts, bends, and twists when the body can better compensate as it does in the upright standing position, when it can add the use of the feet and legs to the compensation pattern and spread the mechanical stress out, so there is a stronger compensation pattern. Now I'm going to show you 3 different rubber bands here, and if you play this back several times, you will note that all 3 rubber bands do the exact same things, but in different places, because they have different mechanical stresses in their inherent nature of the way the rubber is going together. It's astonishing how exactly that follows a spinal column, including the double and triple twists and everything else. Now, I only showed you an animation with an elastic that had a bit of a twist, and with only 1 layer of a twist before. This twisted elastic, with several layers of twist, one on top of the other, is more like what is happening in most adults and many kids' spines. I will show the spring example in X-rays later, but here is an elastic band that is twisting. See how it kinks at this point? That is even before other parts are twisted very much. We didn't do anything special to make it kink there. That is just a natural place for it to kink. Other elastics that we work with kink similarly, but in different places, and more or less. Notice what is happening as it continues to twist. It has developed layers of twist. Now again, I'll go into the specifics with each set of X-rays later for those who want to see them. But can you imagine trying to straighten this out by force and having it be successful? Never happened. Even if the treatment shifted the pressure enough to give relief at any one spot, the body might get a slightly different configuration, and that mechanical stress might get shifted enough to relieve a particular pain. But the spine and body would also get into a tighter twist and be some version of worse overall. This explains the big mystery of why chiropractic adjustments, osteopathic manipulations, and other bodywork treatments do not hold in place. It also explains the variable results you get from different bodywork treatments, be they good, bad, or otherwise. They are all attempts to force bodies into a better position against the meningeal adhesions and compensation patterns the body creates to deal with the bones out of place that it cannot self-correct because the body has no muscles that can pull in the direction needed to correct them. Everything else that happens to bodies, nerve problems, muscle problems, ligament problems, and everything else that is not cancer, infections, diabetes, and the like, all of that happens as part of the compensation pattern after the bones go out of place in a direction the body cannot self-correct, and is a waste of time to treat them. To get people healthy, rather than just shift their compensation pattern to something that is hopefully more comfortable or livable, but is often worse, to get them healthy, what must be done is to pull apart the meningeal adhesions that can be pulled apart that day, and to correct the bones out of place that the body cannot self-correct that can then be corrected that day. Then, you have to let the body unwind and self-correct everything it can until it runs into the next set of things it cannot self-correct. That might be meningeal adhesions or bones out of place that the body can't self-correct, whatever it is. You have to wait for that to happen, and then you have to correct that next set. And that could take hours to days, sometimes weeks, before you can correct them. Doing that, you will see the body unwind or untwist through all its old injuries, just like untwisting a rubber band and correcting that. And you will see people regain health. That is what everyone but ABC practitioners have been talking about but unable to accomplish. Again, later I'll show films of supposedly irreversible degeneration in the process of disappearing and regenerating, but it is happening with people getting ABC treatment every day all over the world. So meningeal adhesions are the other reason that trying to force a spine or some bone into a better position is virtually always a waste of time. But this is the summary. So in a later chapter, I will show you meningeal adhesions, how they stick bodies in a compensation pattern that cannot even be changed without the release of those meningeal adhesions. Forget about trying to correct those compensation patterns. And I will also show you treatment that actually does release those adhesions, which then allows the practitioner to correct the body structures. The only thing really to say here is that practitioners who tell you they are dealing with meningeal adhesions using just light force are either just plain lying to you, or they're so ignorant of what the adhesions are and what they do, that those practitioners are just saying what is fashionable to get your business and have no idea what they're dealing with. Those adhesions and scars are not coming apart by any means other than a good forceful maneuver in the proper direction. It feels like a gigantic stretch. This is why none of the previous methods attempting structural correction of human bodies has ever worked consistently on anyone. And that's considering since before the times of the Greeks. Even thousands of years before the Greeks, the Chinese had manipulation, and it didn't work consistently and predictably. And thousands of years before the Chinese had manipulation, manipulation was known in Vedic healing. But like Western medicine, none of them have any record that someone noticed that bones go out of place in a direction the body can't self-correct because it has no muscle or combination of muscles pulling in the direction needed. So even the ancient methods that people seem so enchanted with and are trying to go back to, like Vedic medicine and all that, even they were not as consistently as effective as you will find advanced biostructural correction to be. One question ABC practitioners often get is, what exactly is unwinding? Unwinding is the process your body goes through to unwind or untwist through all the problems it's having that you've seen earlier in this DVD. The reason it is called unwinding is that that is the best way to think of a spine. It is twisted and bent, maybe even kinked, like a spring, here like this, like a spring that is bent, twisted, and kinked. Now, here's that first guy's X-rays, and here's what that would look like as a spring. See these areas that are kinked and bent? Well, those kinks and bends show the mechanical forces that are on this spine that you would otherwise not see or not know about unless, of course, you were engineering oriented and you measured each tilt of each vertebrae in each direction as well as the length of the spine. So what must happen to the body to get well, and the reason I say must happen is because this is the way bodies are made. It doesn't have to be that way because Jesse Jutkowitz says so. It has to be that way because this is the way the bodies work. So what must happen for the body to get well is it has to unwind through all these kinks and twists to get back to its proper position or its best mechanically operating position. Now, you might not think that's possible for you, but here we have X-rays of a 70-year-old man, and this first one is April of 2011. The next one is August of 2011. The next one is April 2012. The next one is August 2012, and this last one is November 2012. And you could see how this is unwound. Now, most of you are looking at this going, huh? Because it's really not easily understandable, and that's true. But let's look at the side view. When you look at the side view, what you're going to see here is the same thing. April 2011, August 2011, April 2012, August 2012, and November 2012. Now, again, the X-rays are hard enough to see, especially at the neck area, so you can't really tell anything. Well, let's put in some lines. Now that we have the lines drawn in, it looks very different, and now you could start beginning to notice things. If you look at this first one over here, you can see the lines are very herky-jerky, and one goes one angle, one goes the other angle, and these lines are the ends of the vertebrae. You look at the second one, and it's still pretty herky-jerky, but it looks quite a bit smoother, and if you look up here, look at how much this neck has stopped coming forward. He's very tilted forward here. You can see how short this is here, much longer here, and much smoother. But that's not the important region. The important region is actually down here below. But people don't notice that as much because the curves are smaller. But because of the size, the smaller curves actually involve more force and they're more important. Now you look at this one, and this is unwinding. This has actually gone forward toward that other direction over there that he was in. But look at how much smoother the bottom is. That's where you're looking. And then this one over here looks downright sinuous. It's nice and curvy. And this one looks, actually from about this point up, it looks more curvy, but down here it's a little different. Well, ultimately this will all be a big C curve like this, and then just after it gets to be a big C curve like this, that whole thing will come in and straighten out. Now these are the front views. and they look good enough. You could see it's starting to unwind and untwist. But now we're going to look at the side views, and we're going to put the lines in them. And when we put the lines in the side view, then you'll see even more and better changes. So now you see the lateral view, and you can see this one's from April 2011. These are the same ones: August 2011, April 2012, August 2012, and November 2012. There's abrupt curves here, and there's flat spots. See these flat spots here? You can see those lines. That's where there's no angle between the vertebrae. Now your vertebrae are supposed to be a different angle all the way up a little bit. You can see the second one, it's better. And that's actually the main way you can tell you're getting a person better, is if they have more curve on the lateral X-ray. And then the third one, it's getting even more curvy, and you can see there's no straight lines there because every vertebrae is a little bit different than the other. But it still doesn't look right. It's too flat. Here it's too flat. This is a little bit too abruptly curved, and then it's pretty flat up here. The next one, you can see it's actually more curved down here. It moves. It's more sinuous and more curvy until you get up here. And then the last one, that looks darn good. And so his body is unwinding. You have to put this together into a three-dimensional model, and then you could really see how it untwists in 3 dimensions. But if you look at the front view and the side view, and you see the curves getting better, and you can put them together, you can see that. Now this is a 70-year-old man who gets treated every 2 or 3 weeks for about 5 or 6 times a day. And his spine is unwinding. It's a little bit slow, being a year and a half like this, to just get to this point. But that's better than anyone can do anywhere else, because we correct the things that are out of place that your body can't self-correct. Your body must unwind and untwist as it needs to. You cannot force the bones into position. You must unwind the bones, like I said before, and let the body untwist. This is also the best explanation of why any treatment that tries to force bones into a better position might give relief in the short run, but is sure to fail or even make people much worse in the long run. Sometimes a bone is being held out of place by muscles. This will only happen as part of a compensation pattern. Yes, it causes pain and problems at the point where the bone is being held out of place by the muscle, but the so-called correction of the position of that bone, either by direct manipulation or by working the muscle so it lets go while the person is laying down or sitting, can only have 2 results. The most frequent result is that when the person gets up from the treatment table or chair, their body usually just pulls that bone right back out of place to reset the compensation pattern. These are those cases where the practitioner corrects something and it works and feels better in the office, but as soon as you get up and walk to the car, it's out of place again. So that is just a big waste of time and money. Less frequently, but more harmful, are the cases where the muscle is worked on so hard, or the bone so forcefully manipulated, that the body cannot pull on the bone and return it to its best compensating position. In these cases, the body must create a different compensation pattern. Those are the cases that are pretty dangerous, because the new compensation patterns the body must create are almost always worse, since the body now must compensate for the damage done also. A similar thing happens with compensating bones out of place that are not pulled out of place by muscles, but are just pushed out of place by the forces created when the body creates the compensation pattern for the things it can't self-correct. This would be like a knee that gets twisted every time a person walks, but that he or she can just straighten by stretching or making a crack, or a shoulder that keeps cracking or something like that. The body can self-correct those, but does not, and keeps returning them to the out-of-place position because they're part of the compensation pattern. If some practitioner attempts to correct them, you get the same situation where they push it back into place. It feels better while you're standing there, and then immediately when you get up or on your way to the car, it's back out of place, so it's just a waste of time and money again. These are the cases where, it keeps coming back, or when is the correction going to hold? Those are those cases and why those happen. By the way, there's an interesting study about people cracking their knuckles or other parts of their body. They gave a questionnaire to older people. It was one of these questionnaires with over 100 questions, and one of the questions was, during your lifetime, have you cracked your knuckles or other parts of your body? Somewhere else in the questionnaire was another question, which was how much arthritis or degeneration or any problems like that you have. Well, it turns out that the people who did a lot of knuckle cracking and all that had less arthritis and degeneration, which is the opposite of what people commonly tell you. I guess they tell you that because they don't like the noise or something. But the people who do that have less. And that fits with the fact that the degeneration and the pain occurs at the compensation points. Well, those are things, compensation points are things you can self-correct. So even if you crack your knuckles or do something like that and the problem returns, at least you're getting some temporary relief. Now, looking at standing and sitting full spine films for a few decades, and this is before and after many different types of treatments, including having people get treated by other people using different methods ranging from massage and rolfing to orthotics or other methods of manipulation, and even including changes made by surgeries. Measuring full spine standing and sitting films and measuring every angle of every vertebrae to really understand if the mechanics are improved or not, I can tell you that those changes rarely improve people. As a matter of fact, you'd probably be astonished to learn that most methods of manipulation, including most chiropractic methods, do not change people's body mechanics at all. They just make these small twists that sometimes result in temporary relief. Here's a person who's been getting chiropractic and actually a couple other types of manipulation for 13 years and got virtually no change in her neck at all except for more degeneration. Then she gets 3 treatments with the advanced BioStructural Correction protocol and immediately gets a fantastic change. And that's a typical change. So when I tell you most methods don't really change people, I'm not talking out of my hat or trying to make other people wrong. This is from decades of observation using full spine standing and sitting X-rays. If you're not getting advanced biostructural correction, it's unlikely you're getting significant change at all. And I will warn you that it should be from a certified ABC practitioner, because many patients have discovered that their practitioners were telling them they were doing ABC, but actually giving them God knows what for treatment, because when they traveled and looked on the ABC Miracles website for a certified ABC practitioner, what they got was very different and very much better. It usually has to do with the understanding of the role of the meningeal releases that certified practitioners must show. So again, what must be done for a body to regain health, and I say must be done because of the way the body works, not because it's my idea. What must be done is to correct only the things that the body cannot self-correct that can be found that day and correct them the best possible. Then you have to wait and let the body self-correct everything it can self-correct, which unwinds or untwists the spine and body until that unwinding process hits the next thing or set of things that the body cannot self-correct. At that point, you again have to get someone to correct only the things the body cannot self-correct that can be found that day. And again, you have to wait for the body to self-correct everything it can and untwist or unwind whatever injury it's trying to fix until it runs into the next set of things it can self-correct. And then you get someone else and so on. That will relieve more pain and restore more health than most people believe ever possible. Doing this is actually rather easy, and the pains most often go away rather quickly because they're usually related to the last set of compensation patterns created. And as you saw in those first visit before and after pictures, the body immediately pops upright and the posture stays up all by itself without you having to work at it. Now, because there are many layers of problems, the things I've shown you previously, the immediate relief of the pain and gains in health that you get from the first few treatments are just a small sample of what can be accomplished in the long run. Chiropractors and others have long claimed that consistent treatment would result in more and more improvement, but they didn't know about bones out of place in a direction your body can't self-correct, so they were trying to force it into place. And you have to remember that the political chiropractors, with the support of the chiropractic colleges, outlawed sequential full spine standing and sitting films like before and afters because they did not show any improvement on a consistent basis, especially in the long run. Well, all that has changed. With the discovery that bones out of place can be divided into two very large categories, those that go out of place that the body can just self-correct because it does have muscles pulling in the direction needed to reposition them, which by the way happens to you and everybody else every day, and the bones that go out of place in directions the body cannot self-correct, for which the entire body must be wound up or twisted to compensate. You know, it's a common mistake to think that one thing goes out of place and another thing compensates. That doesn't happen. As we've shown you in these X-rays and animations, something goes out of place and the entire body goes into a twist to compensate. That is why, though the immediately noticeable effects of being treated with the advanced biostructural correction protocol are fantastic, but it takes repeated correction of the next set of bones out of place that the body cannot self-correct with unwinding, and then more correction with unwinding, for people to fully recover the absolutely fantastic health that their bodies are capable of recovering when they are treated with the advanced biostructural correction treatment program and truly corrected. And remember, this is not some pie-in-the-sky prediction. People's bodies recovering fantastic health beyond what anybody believes possible at this point is happening every day worldwide with people who stick with the long-term treatment program suggested by their certified practitioners of advanced biostructural correction. There is more about meningeal releases, why they're necessary, what they do, and even more data. But many of you are not so interested in those details and have enough information already. So see your certified ABC practitioner and discover the fantastic health your body can recover. My name is Dr. Jesse Jutkowitz, and I wish you good health and a good life. Should you have any problems or want to tell us something fantastic about your recovery, please send me a personal email at jessejutkowitz@gmail.com. Thanks, and good luck.